audible. So I wanted to first, since we have a small group, we may have a max of 12 or 15 people today. Right now there's fewer than that. But I wanted to see if people would be willing to just introduce yourselves and say who you represent or where you work or why you're interested in this, one of those. So let me start with Misty, since you were the first one to come on.
Hi, my name is Misty Guantonio. I work through Life Path Recovery, which we've got some doctors on contract with us.
Great.
And I'm with her. I'm Murray Brooks.
Oh, hey, Murray.
Hi, Greg.
And then Carol.
I'm a licensed pharmacist with a consulting drugless pharmacy registration, doing patient counseling on substance use disorder as well as other medical issues.
Okay, welcome. Marty G.
Hi, I'm Marty Grassmeter. I'm a pediatrician, and I'm in the HPSP program. I've been in it for a little over a year now, and I'm currently not working. So I thought it'd be good to sit in and hear what you have to say today.
Okay, great, welcome. Phil.
Yeah, hi guys. Philip Hemphill from Tulane University, and just history of working in the industry and with you wonderful folks. Like to hear what you have to say today.
Thanks, Phil. Good to hopefully see you in a minute if we get videos turned on. Stephen.
Hi, I'm Stephen Walt. I'm the CEO of Veritas. We do two things. We have a virtual intensive outpatient program for medical professionals in New York, and we have a physician coaching program as well.
Great. Tom.
Yes, I'm Tom Specht, and my current involvement with this type of activity is with the California Medical Association Physicians Confidential Hotline.
Thanks, Tom. And then Greg Abrams.
Hold on. Let me get myself oriented here. Okay, now I'm unmuted. Yes, Greg Abrams, attorney in Oakland, California, representing physicians, among other things, representing physicians before the Medical Board of California, as well as in matters related to peer review in hospitals. And I have quite a number of physicians who have substance use disorders and are going through the whole process.
Great. Let's see, we have one other. Okay, no, I think we're good. All right, so, well, I'm so glad everybody came in. It sounds like we have a really diverse group here, and it's a small group. So we'll kind of treat this more like an interactive process. So if you want to interrupt and ask a question, please do so. Just unmute yourself and ask away. So we are talking today about this issue of what licensed professionals say on applications when they've had mental health issues, specifically substance use disorder issues. So as you guys know, people, licensed professionals now, and I'm going to focus mainly on physicians since that's been the main group I've worked with, but every of the 30 or so licensed health professionals, all the way from, physicians, nurses, dentists, veterinarians, all the way down to, acupuncturists and massage therapists and all of those that are licensed have to undergo they're required to answer these questions on credentialing or licensure applications. And so this comes up, and so when you apply for a license or relicensure, hospital privileges, or hospitals require renewal of privileges, and there's an application for that. Malpractice insurance, job applications. If you're looking for a new job, there's usually a questionnaire, and it often contains a question that we're going to talk about. Board certification. So the specialty societies often will ask questions. insurance companies that you want to be on their panel, like as a HMO or a PPO or any of the other alphabet soup insurance companies now. When you apply as a doctor to be on the panel, they'll ask questions. We've had doctors that are pilots, and the pilot license asked questions, or any pilot is going to have to deal with this. Some states ask it on driver's license renewals. Oregon does, I know, asks questions about what we're going to talk about. Life insurance policies, your personal health insurance, disability insurance, and there's probably others. Those are just the ones I thought of as I pondered this before the webinar. The point is that licensed professionals are faced with this question that they're going to have to answer one way or the other. And what is the question we're talking about? Well, usually it's something like, have you ever had, or have you had within a certain time period, a condition such as, and often they mention mental health or substance use disorder, that if not treated could cause impairment. Okay, so that's pretty straightforward. Now, there is an article that I want to show you guys. We'll share the screen here. It's a really pretty good article. You can find it, it's Licensing and Physician Mental Health Problems and Possibilities. So this article is about a subject that's become kind of a hot button thing and may change some of the questions. So what this is about, it's not exactly what I'm going to talk about today, but I want to cover it briefly. And this is the issue of the fact that states ask questions about mental health. Does it discourage doctors from getting mental health care that they need? And does it increase the risk of suicide and or impairment that could put patients at risk? So this article was published in the Journal of Medical Licensure and Discipline in 2007. It's pretty good. And down here on the left side here, analysis of license applications. So they took the time to look at all 50 states, and they found that 40 states asked directly about mental illness, 20 about impairment due to mental illness, and 20 asked about diagnosis, treatment, admission to a treatment facility, or a combination. So they also review the questions. So here are some of the questions that people have to answer. This is specifically talking about license applications, but the same questions can occur on any of these other things, license renewal, and it varies state to state, okay, quite a bit. And that's pointed out in this article. But all these other things that doctors have to contend with when they apply for stuff. And so what are some of the questions? So here's one of the common ones that I almost already said, which is the kind of generic one I mentioned. Have you, and then parentheses, within a certain period of time, been diagnosed, treated, or admitted to a treatment facility for a mental illness or disease? So that's a very broad question. Have you been diagnosed, treated, or admitted to a treatment facility for a mental illness or disease? So I worked for the state medical board in Alabama for 12 years prior to moving to California 10 years ago. And I worked closely with them, and they asked a question very similar to this. The problem was they were getting inundated. There was 14,000 doctors in Alabama at the time, and they were getting over 500 yeses a year, and that's probably a fraction because of depression or other fairly, less concerning types of mental health diagnoses. And so they actually changed their question and indicated only treatment, inpatient. They mentioned inpatient treatment for mental health or substance use disorder. And the number of responses went down, which made it more manageable for them to follow up on all those questions. Because you can imagine the board, the medical board, was faced with, say, 500 people saying yes. Think of the time that took to, inquire and evaluate in some degree all of those respondents. So anyway, this article is about how these questions deter people from getting help. And I think that's a really valid point. So not only have they changed questions for the convenience of the board because of so many people maybe saying yes, but also to decrease the stigma around getting help. This same thing is true for pilots. I used to be an air medical examiner, and I had a lot of pilots that would ask me off the record, they would say, off the record, can I get my blood pressure treated? What pills can I take or that are legal and so forth? So people are avoiding getting appropriate care sometimes, obviously, because they don't want sanctions. And this can cause things to actually be worse. So some other questions. Do you have a mental condition that in any way impairs your ability to practice medicine? So do you have a mental condition that in any way impairs your ability to practice medicine? So just think about the physician who has been in treatment for, alcohol use disorder or opioid use disorder or any other substance use disorder. Do you have a mental condition? So this is a question they look at, and it's like, how do I answer that? I have this disorder. It's in remission. Does it impair my ability? And they're often thinking, well, no, I'm not impaired. But it doesn't put a time limit on it here. And it makes you wonder what kind of a response are they looking for from somebody who, who's in recovery, who's in remission. Anyway, so they also use, this impairs is the word used here, but they also use interferes with, limits, hinders, adversely affects. Sometimes they say currently, and then they'll sometimes put qualifiers like currently means in the past year. So you can see how difficult this gets, but the fact is these questions are asked, and we may come back to this article in a minute because it does have other really good stuff in it. If you want a copy of this, just email me, by the way, and I can send you a copy. I see we've had a couple more people join us. When we started, we had people sort of introduce themselves and what organization they represent or they're associated with. So let me go ahead and ask the other attendees that have joined us more recently. So Mike Setcher, do you want to introduce yourself and say who you work with?
Hey, Greg, how are you?
Good.
Good to see both of you guys. Well, I work with Arizona Medical Board, Nevada Medical Board, and California, but mostly, and this is a fascinating topic, and Stephen Wolt, who introduced himself earlier, I've been advising and working with them on the development of this outpatient, virtual outpatient program. And one of the very issues we were talking about as recently as this morning was, when do you have to answer yes or no to these questions? What's the implications, and so on. So your topic's really timely. I, like you, have a lot of experience with guiding people through how to read the question thoroughly, tell the truth, answer the question accurately, but not kill yourself in the process.
Erica?
Oh, hey there. This is Erica Morris. I work with the UCLA Physician Health Program and Physician
Oh, yeah. Hey, Erica.
Hey.
Great. Thanks for joining us.
Yeah, thank you for inviting me. This is very relevant and important.
You're welcome. And Linda, you'll have to unmute and let us know, introduce yourself if you don't mind.
Hi, Dr. Skipper and Jim Conway. It's Linda Bresnahan.
Oh, hey, Yay! Yes,
I work with the Federation of State Physician Health Programs, as you know, and
absolutely. Thank you for joining us. And
yeah, glad to be here.
great. And we're trying to get everybody's video turned on. For some reason, it was set to not allow attendees videos. So we may get that fixed. If not, we'll skip it. Anyway, Tracy.
Hi, I'm Tracy Zemansky. It's great to see you guys and to hear familiar voices. Current president of Pacific Assistance Group, and we've been running a private program in California since 2007.
Great. Thank you for attending. So we have a wide mix of people from different aspects of working with, professionals. And it's a small enough group that I've invited anybody that wants to chime in. You can either click on your raise hand button or just unmute yourself and interrupt me at any point, because I want to make this interactive. I think we'll get a lot more out of it if we share our common experience and knowledge. But anyway, so I went through, I've already gone through like some of the issues. Well, basically, physicians have to answer these questions, and they're often a little hard to interpret. They are hard to interpret. And so I run a group. So I have a curriculum of like 12 major topics that I cycle through in my professionals group. And this is probably one of the most important, and people often, I think, get the most out of this group, because this really is a real life thing that people have to deal with. So the first question I ask, but by the way, I have everybody bring a piece of paper and a pen or pencil to the group, because this is an exercise kind of group. And so the first question I ask people is, when you face this question, do you think you should be honest or lie?
Yes.
And so, most people ponder that for a minute and say, I think I should be honest. But occasionally I've had somebody say, I'm definitely going to lie. So the first thing I talk about is, what are the consequences of being dishonest? Well, they may not get found out, and I don't know what percent get discovered, but what it does is, if you lie, it really does make you hesitant to be involved in things, recovery activities, participating, say, in the hospital well-being committee, because you're in the back of your mind, you're realizing, hey, I need to be in hiding. I've lied. What if they find out? So it sets up a situation where somebody is going to be feeling not only, hopefully shame about lying, and that's not a recovery behavior, but also just inhibits their participation. So if somebody says I'm going to lie, then I open the group up to talk about why do people think that's a good idea or not, and we kind of hash that out. And sometimes they change their mind. Sometimes they stick with their opinion about their dishonesty. Nobody knows about this, so I'm not going to tell anybody, sort of thing. We have a patient in treatment right now who's a nurse who has that attitude. And so we've talked to her about, you're going to have to lie on a bunch of forms. How do you feel about that? And she's like, I'm fine with it. So what do you do with that? I mean, you can't really, you can make it a therapy issue, but that's the way it is. So the rest of them, I think, make the right choice, and they realize they're going to have to say yes, maybe, on some of these questions. So the next thing I do is talk about the questions themselves, which I've already done here. I think most of you heard some of them from this article, where they queried all the state medical boards. And these questions are vague. So things like, do you have a mental condition that in any way could impair your ability to practice medicine? People can go either way on that. And I caution doctors to not make this decision on their own, because they might, they have shame about their illness a lot of times, residual shame, even if they're in good recovery. And you kind of rather not have to deal with this. So it's easy to get your sort of misinterpret the question and think, well, I don't think I need to answer yes to that because I don't currently have it. It doesn't say a time period, but I think they're talking about right now, and I'm in remission. I caution people about that because I think their judgment may be impaired by their conflict of not wanting to say yes. And so they could end up inadvertently, being fraudulent on this application based on what the board thinks you should do. And that's the important thing, is the organization that came up with the question, whether it's a hospital, medical group, medical board, all those people, what are they designing the question to try to elicit? And so I caution people to not make their own interpretation of the question without some care, and consideration, because what they want to do is answer it the way the asking organization wants you to answer it. And that's difficult to know sometimes. So one thing you can do is call the organization. So let's say you're filling out an application for a licensure in the state, and the question pops up and you're pondering, do I need to say yes on that? You can call that board and say, look, I'm a doctor, I'm applying for a license, here's my situation. What do you think I should say? Well, who are you getting on the line? Is this an investigator? Is it the executive director? Is it a secretary of the executive director? Or you don't always know exactly what authority they have, even if they tell you who they are and their title. So they may say, yeah, you can say no. Well, what I always advise people, if you do something like that, get it in writing. Greg, I think you would encourage people to do that. Lawyers think about those things. And the fact is, if later it's discovered that you said no and the board thinks you should have said yes, and you say, well, I called and somebody told me I didn't have to, it may not carry much weight. They may not believe you. And anyway, they may disregard it because that person didn't have the authority to make that decision. So if you're going to query the organization, be sure to get it in writing in a substantial enough way that it could be defended. The reason I'm saying that is because having a problem with mental illness and substance abuse is an issue, but it's almost not as big an issue as fraudulent application. So the boards I've worked with a lot of boards actually now, maybe there's some that aren't sympathetic to doctors in recovery, like California. But most states, I would say, actually the boards are fairly enlightened and they understand that if a doctor has a substance abuse problem and they get help and they're in monitoring, they're safe. But they're not so happy about a doctor that lies on an application. That looks almost like some kind of antisocial tendency. And the board really, I think, comes down on that harder than they do on the doctor who's had a mental health problem that's in good standing. So I really caution people to be careful about this, even the well-meaning ones that look at the question and think, I think I can say no on that. Get some advice. And so who do you get advice from? You can get it from the asking organization. You can get it from anybody else. You can take it to a professionals group, like a caduceus group, and say, hey, I've got this question I got to answer. What do you guys think? You can ask your attorney if you have one. You can ask your sponsor. You can ask your wife. But ask people so that you can get out of your own head and get some perspective on that rather than trying to decide on your own. So let me stop there and see if people have comments about that. So what have you advised people to do that say, well, I've got a question here and I don't know how to answer it? What do you think the best way to resolve that is? And I'd really like to hear from anybody that wants to talk about it, but particularly from Greg Abrams, the attorney that represents doctors. So yeah, Greg.
I don't want to jump in front of anybody because
it's okay. I called on you.
Okay. This is a question I deal with all the time. Now, the medical board was brought under a little bit of fire in the past couple of years about these questions, because when you start from the perspective that the government has certain restrictions and can only do what it's authorized to do, then you come to the realization it cannot invade privacy without a good, valid governmental need to do so. So if you're saying, have you ever had a mental disorder or a substance use disorder, question mark, then that's very overbroad, because it's only under certain circumstances that would be relevant to the board or licensing entity. So that also violates California privacy under the state constitution, HIPAA, right? Government is just as bound with certain exceptions. So what happened with the most recent iteration is the board determined that it really needed to, I think most of the licensing boards, if not all, determined that they need to limit these questions to relevance to today, to the issue at hand, which would be a new application. We can talk about renewal application in a minute.
Yeah.
But as to the new application, the applicant has the burden of proof to show he or she is worthy of being a doctor, a licensed physician, I mean. So they changed the wording on, let me get over to it here, to three questions on practice impairment or limitations on the new or the initial licensing app. And that is, it's all based on currently. Are you currently enrolled in or participating in any drug, alcohol, or substance use recovery program or impaired practitioner program? So current enrollment and involvement, say in PAG or going to AA meetings and that sort of thing, not just enrolled but participating, or an impaired practitioner program, which would be the PHPs, that would bring a yes answer, and that would bring an investigation. The next question of the three, do you currently have any condition, including but not limited to emotional, mental, neurological, physical, addictive, or behavioral disorder, in case that wasn't clear, that impairs your ability to practice medicine? And then the catch-all, do you currently have any other condition that we didn't list ad nauseum in the prior question that limits your ability, impairs your ability to practice medicine? So enrollment and participation in, when I'm dealing with a client who is either in rehab or enrolled in PHG or similar, that answer is pretty clear, yes. And then the question becomes, how do we properly craft a narrative, right? We pull together stuff and make sure that it's factually accurate. Currently having a condition that impairs your ability to practice medicine. So that's really, to my mind, not so hard if the physician is actually practicing medicine, and to the best of my knowledge is the attorney, understanding the physician's doing fine. If I find out otherwise, then I've got to chat with the physician and kind of come up with some other, response. But really, a condition that impairs is an active process, and you can have, all kinds of back problems. You can have neurological, muscular dystrophy or sclerosis or those sorts of things, and still practice just fine. So the answer would be no under those circumstances. And then, bear in mind, there's another question way up here that says that could serve as the net to bring in this information. Let's see, have you ever been subject to discipline in a medical staff? Yeah, that could bring it in, right? Where's the other one that I want to look at here? Have you ever been convicted of a felony or a misdemeanor, right? That could bring it in, DUI can bring in the whole thing.
Right.
And have you ever had a leave of absence for more than 30 days?
Right.
And that can bring it in. So that's kind of...
And by the way, I want to just mention that you're talking about California.
I am talking about California.
Because we have people from all over the country.
Okay. And I think this has been a trend on licensing boards and the like. So.
And then on the renewal, it's one of the things that surprises me about California, which is one of the harshest states from my experience as far as how the board treats licensees. The odd thing to me is on the renewal, it asks almost nothing about this. It only asks about, legal issues. Have you been arrested or, that kind of thing. Do you have a comment about that?
Yeah, correct. And I, as a layperson, I don't get to see the renewal app because it's online, but I learn of it through my clients.
Yeah.
And much to my happiness, it was only a few months ago that I determined, it doesn't ask the same question on substance use disorder level. And that came into a question when I had a new client who had gone into rehab and into one of the monitoring programs with a large medical group, and never became the board never discovered it because he handled it, and he did so well enough with his well-being committee and was being monitored in that fashion with external programs and the like. And the question was, well, you're going to renew your license soon. And then he said, do I have to tell the board then? Which would really screw things up pretty badly. And in fact, that's when I discovered, no, you don't even actually have to tell the medical board. And that's a good thing because the medical board jumps on it and just makes life more miserable for you while you're trying to cope with working and recovery. So yes, so in California, the renewal app does not cast its net to those data.
Okay. So does anybody else have comments about that part of our discussion? Is like, how do you determine what to say? Respond to these questions. Any other comments? Okay. So the point is that it's sometimes difficult, and I encourage people to consult others, and I think what Greg said is very accurate. And he's willing to defend people, based on his advice. But still, I think you could run into questions about that, like what is the definition of currently? It seems obvious, but some boards say currently in the past year. Currently means the past year, that kind of thing, or more.
So Greg, can I make one other comment on that? Because you were talking about folks who don't want to be honest. So especially if you have substance use disorder of some kind, alcohol or drugs, and you're in a program or you're expected to be in the program and you're expected to recover from it. I make clear to my clients that if the medical board determines you have lied or even wants to decide so, then they will presume you cannot recover from substance use disorder or get into recovery adequately, because that's a fundamental tenet, is to be honest about who you are, what you've done, and what you need to do. So there's a presumption against you if you are, and it goes to the very recovery issues that you're trying to show makes you worthy to nonetheless practice medicine.
So basically, you're making the point that I make, that there's severe consequences for being dishonest on these applications. And so, I try to get people to see that and understand when they're in treatment. Many of my patients really don't have the choice because they're known to a board or a PHP, and they're caught already, more or less. But some that have voluntarily come forward, which we want to encourage, right? Don't want to be honest. So that's the whole issue about why are the boards asking these questions, but it's a balancing act, right? Okay. So the next thing I do in this group is I say, okay, imagine that you're filling out an application. This question comes up. Let's say you do say yes on it from any of the questions that could lead into this. And you're going to always ask for an explanation, right? So I take about 5 or 10 minutes and I have people write out their explanation to, say, the board or the insurance company or whoever it is that's asking the question. How do you explain what's happened to you? So this turns into a great exercise, and I would encourage any of you that lead groups for physicians or other health professionals to do this exercise. Now, ultimately, I always tell them, like, we're going to develop your statement here and we want it to be the best it can be, but you want to run this by your attorney if you have one, before you finalize it, because, you know, legal advice really matters on this. But I think it's a good exercise for people to go through to look how they're doing it. And so before they start writing, I always say, what do you think the point of this is? What does the board want to know? And so then we have a discussion about what is it the board's interested in, you know, and they always come up with things like, well, the board wants to know that you're safe. The board, you know, has political pressure on them to identify these kinds of things because of stigma. You know, the board wants to be nosy and find out about you or whatever. So, you know, people respond different ways. But the bottom line is they want to know if you have a problem that you're going to be safe and that you've taken care of it and that they can trust that you're safe. So with that in mind, I have people take time and write out their explanation. And then once everybody's written it, I ask people to read those explanations and then let others comment on them. We all, you know, join in and question and have them read it a couple times if needed. And it's amazing the transformation that people go through in just the little words and phrases and how they, you know, in the extreme, I've had some people become very, you know, ridiculous about saying, you know, I'm a good person. I've done all these great things. You know, I'm whatever. You know, the board doesn't care about that stuff. You know, they are facing, you have a substance use disorder. What have you done to be sure you're safe? And saying I'm liked by my patients or I've gotten all these awards or whatever, it's irrelevant. So we want to focus down on the wording. And so things like, you know, some people are in the treatment process are very into, and it's great, they're very into being honest and self-disclosing. And so they may be exuberant about saying, I'm an addict. You know, I'm a liar. I'm an addict and a liar. You know, that's a first step issue maybe in a treatment program in a 12-step setting kind of, but that's not what you want them to write on their explanation, right? So we tell them you can spin this a little bit because you're trying to tell the truth that satisfies the board, but doesn't create a lot of concern. And so I like for them to use, instead of like alcoholic or addict, I say, you can use the phrase substance use disorder or alcohol use disorder or opiate use disorder, and so forth and so on. And some people want to say, you know, I have completed a long-term treatment program for physicians. Well, why do you put long-term? That might just you know, that might reassure them, but it might cause them to think, wow, this person's had a serious problem if they've been in for long-term. So in other words, think about how it's going to be interpreted, what they need, and then, you know, supply them with what they need. You know, I've successfully completed treatment at a special program oriented toward professionals, and I'm in monitoring and I'm compliant with all requirements. So brief is good, and not a lengthy explanation is often better. But you'd be surprised how often I have people read these lengthy explanations because they have shame and they feel guilty and they're trying to explain themselves and try to convince the board that they're good people. And that's not the point of this. So I'd like to open it up for people's comments about that. Anybody have comments? Mike?
Yeah. Well, I mean, having done a lot of this, I agree totally with what you're saying. First of all, you don't ever want to lie or be perceived as lying.
Right.
Because, you know, they can deal with people who are sick or who have illnesses. They don't deal well with liars. And even the perception. And in terms of writing the letter or responding to the question, I always tell people, one, you have to tell the truth, but I would stick to facts, not feelings, that less is more, because if you don't write enough, let them ask for more. And that if they're 12-step familiar, don't do a fifth step with your
Right.
medical board.
Right.
And I really believe that. And I've had a lot of people write way too much. I had a guy who wanted to get back into his GI fellowship after a cocaine relapse. And he came back without talking to me and told the program director all the times he'd called in sick when he was loaded, all the times he'd lied, all the times he came to work high, all of this stuff. And he almost didn't get back in. And I had to intercede. And I said, really, all you had to tell him is, I had a relapse. I went back and got treatment. I'm back in monitoring. I'm doing well, and I want to come back to the program.
Absolutely.
And so you're right. Less is more.
Great. So I go through this process with people. Everybody in there gives feedback. We start seeing how you can streamline this and make it more meaningful and answer their questions to satisfy their need. Greg, do you have comments about this?
Tracy has a question too.
Oh, Tracy, why don't you go first? Ladies first.
Okay, well, it actually was a comment that I always encourage folks to write out a standard statement that is no more than a paragraph that they can use from now until perpetuity on a question that they have to answer yes to. And I have them bring it to the group and read it, and we take out everything that's superfluous, which is almost everything other.
Fantastic. I do the same thing. I tell them, look, once you've gotten a edited version of this that's you think is right, good, and streamlined and meaningful, keep it, because you're going to need it for the rest of your life, basically, because these questions keep coming. Greg?
Tracy's right on the money there. Years ago, I wrote out a list of yes answers. The only thing I have to change is the question number that it applies to.
Exactly. Yep. Greg, any comments?
Yeah, I have to say I tailor and it's true, you use these things over and over from the legal perspective, the HMOs, health plans, the new med staff, blah, 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 on the licensing board. But I do want my clients to show who they are to these entities that don't know them from squat, right? They're a statistic or they're a report is what they are.
Yeah.
And so, agreed. I'm not going to have them say, as Michael said, and I went to work 4 times totally stoned. Yeah, no, that's right. But I definitely have them reveal who they are and show that they have insight into what they've done, where they are now, what they expect of themselves. And that can be lengthy, but by the time you finish reading it, this statistic has become a person to the outfit or to the entity that is reading it. And it is always, I'll scratch a lot of stuff, Don't be talking about your custody battle with your daughter, not necessary. So yeah, you have to filter it, but I want to see, and it's sometimes hard because I'll get clients who don't have that kind of self-critical analysis going on. And so, but that's sort of my approach. And
I think that's an excellent point, but pertinent to what you said is what Mike said, is stick with the facts. I'm board certified in this. I've practiced for this many years. I've not had any malpractice suits. I don't know how you want to portray the person to let people know that they're credible. They've had success in their career.
Well, what I use, Greg, and kind of along with what Greg Abrams is saying, is this is particularly true if you're going to be interviewed by the board or interviewed by somebody, or you have to write a more lengthy statement than an answer to an application question, what I call the 4 R's. Responsibility, yes, I did it. Remorse, I feel bad that I did it. Rehabilitation, I have done and continue to do the following things so it will never happen again. And the last R is return. I want to return to the practice of medicine and help people in my chosen profession. And if you can say those things in writing or in person with sincerity, humility, and a degree of confidence, it's very hard to say no to you.
Good stuff. Thank you, Michael.
But one more thing on that, Greg, is when I'm talking to my clients about it, to get them to try to understand how we're traveling through this document, the mantra is that was then, this is now. Yep. That was who I was then, this is who I am now. And
Okay.
it really helps the client realize, because it's true, then they see that's who I once was, and I'm not that person. And that's what I like to show the board, for example.
But I think comments that I've seen some people make is, believe me, I'm a good person. I don't lie, blah, blah, blah. Some of the things are things you scratch.
Yeah.
Okay.
Or anything with facts about it? I'm just curious.
What's that? Anybody else have comments? We've got about 5 or 10 more minutes. And we can, I'd like to hear if anybody else has comments. Linda, what do you think about this?
Is that me, Linda Bresnahan?
Yeah. Hey, I know you've had a lot of experience. You've been around this
Yeah,
a
I
long
think
time.
everything you're saying is consistent with the types of advice we would give out to our participants. I really admire the process you use to help people work through those together. There are so many nuances. So I think the way you approach it is really both helps the person get to a result in terms of how to respond, but learn throughout it. So our question in Massachusetts was, I was at the Massachusetts program. I haven't been there in 4 years. I don't think it's changed much, but it was, have you had a condition which, oh, now I'm going to forget the phrasing. I used to say this 100 times a day, but essentially, are you currently impaired was the question. And then it defined currently to be 2 years. Of course, all kinds of nuances to it. The definition and the instructions on answering the question, you had to go to the instruction book. So of course, we always encourage people to do that and read the instructions carefully. Otherwise, they might overshare or undershare. And then from there, we would advise people, as you said, to be honest. And of course, with that question, there was an opportunity, as the attorney who first spoke said, for individuals, usually by the time they're addressing this question on a renewal, are already in the PHP or are not currently impaired. So they could answer that question, no, and that was okay. Others, the lawyers in Massachusetts would often give those options, that you're justifiable to say no. Other times they might say, if you wanted to err on the side of disclosing more, you could say yes. And then the advice sort of, just as you said, would start with what to share and how to share it. And just as you said, the first take of someone's what to share was usually oversharing and not sharing, the relevant information for a licensing board. So it required some guidance, really just along the lines of encouraging someone to give a fact pattern, and to think about the reviewers' lenses. In other words, they're looking at, at what on your timeline were you ever at risk to patient safety. So if there's opportunities to share, when you took yourself out of medicine and how your substance use disorder manifested in a way that didn't impact patient care, that might be stuff you would share. But certainly your emphasis would be on, this is the date I got help. This is the date I went to treatment. I successfully completed. I started my monitoring and I'm successful with my monitoring contract. So, and those were the, boring, factual, but most relevant timelines and dates of information to provide in the disclosure. So I think that kind of sums up how we would advise people. I will say, just doing this work for 25 years and being around back when, I think it was New Jersey had the lawsuit on the license applications that won the case, that spoke to questions that shouldn't be discriminatory with respect to the ADA, and having Massachusetts question pretty much fall in line with the ADA. I was shocked 4 years ago when I took this job. I felt like the pendulum had shifted and there was less and less compliance with that ruling of probably 20 years prior, as you all have spoke about here. And now, of course, there's great attention asking licensing boards to adjust their questions from the Federation of State Medical Boards. And I think, there's a lot of national associations jumping on this campaign.
Right.
The American Medical Women's Association has a great website. I think called Heroes. And it's really a movement to help continue the push to get licensing board questions to change. So I was surprised 4 years ago, and even now, so disappointing when a question asks, have you been involved in a treatment program? Have you been involved in a PHP? Because I think that's skirting the ADA, because the reason someone might be involved, might have had nothing to do with impairment, but now they're obligated to disclose it. So that's a disappointing question that I think violates the ADA.
Yeah, the COVID situation, where more concern has, rightfully been publicized about the stress on health professionals, may help push this a little further. So it's probably going to be a pendulum, like most things. It may swing back and forth. One of the problems is we got about 60 medical boards in the country, if you count all the DO boards, or something in that range. And everybody can do it differently, and often they do. And so it's good. This article from the Medical Licensure and Discipline Journal that I cited, it's the Federation of State Medical Boards Journal. So hopefully it would be nice if they standardize this and every state had the right questions. But they don't do that. Every state gets to do what they want. Any other comments from anybody? I did want to mention one thing that Linda brought up, and that is the issue of, boy, it's great when a state can ask whatever the question is, have you had a problem with alcohol or drugs, and put on there that's not known to the state physician health program or whatever, pharmacy assistance program, because that way it encourages people to get help. And there's not very many boards that do that, but there are some.
Right, the safe haven, so to speak, where you can answer no if you're involved in a PHP. That's
exactly. Do you know? I don't know if we know how many states the board has been that enlightened. It's a small number, I think.
It's small. We used to always give Colorado as an example. I don't know if that's still the case there.
Right.
I mean, what's interesting, I think you gave as a reference, if you didn't, the Federation of State Medical Board Physician Well-Being Report. It's on their website.
Yeah.
And so in there, it's advising all its medical boards to do just what you said, which we wish, I think, was mandated, but the Federation can't control its state medical boards, but it advises medical boards not to ask questions about probing health history at all. And if you are going to ask, if a medical board won't skip the questions altogether, then it would be to ask, have you ever had a condition? And certainly never ask about substance use or mental health, because that's sort of discriminating against the illness. Why is substance use any more impairing or mental health than other health conditions that can also be impairing? So I like how it talks about that. So, we try to push that out a lot to people that, the medical board suggesting no questions at all. I do know, trying to collect examples on this, by the way. I'm actually working on an email to state physician health programs to help us collect current examples. And I know the Federation of State Medical Boards is trying to work on an update to us all. I assume will come out in a publication about who's changed since that 2018 report. North Carolina is an example I'd like to mention, because I believe they eliminated their health question, and they have a nice advisory in there, if you have a condition that you're concerned about, to, what to do about it and to take action. And so that was a pretty proactive,
that's great.
Prevention approach, so to speak.
Anybody else of the others that haven't been speaking have comments? Marty, Carol, Misty, Tom, or Erica? We have a small group, so if you have comments or questions.
Greg, a quick comment based on my experience, and in particular with the CMA hotline. I think that most physicians are under the misguided impression that somehow the medical board, wherever they are, is going to advocate for them. They don't understand that their mission statement is public safety, period. Has nothing to do with physician health or physician safety. And I find people that I talk to don't really appreciate that fact. And when you come from that perspective, then you understand why these questions are the way they are. and how they're constantly evolving. The second thing is that I've had a number of calls over the years that physicians don't understand that not only does the medical board sample the DUI and criminal database, and they expect you to report, but that will invariably, like in a state like California, where there is no mechanism to deal with that in a healthy, PHP kind of way, that is something that they don't understand the need to report. And we had a call recently to the hotline where the physician didn't understand that they needed to report that. Not only will the medical board find out about it, but there was the expectation on the medical board's part, and it's right there in the B&P code, that you will report any kind of criminal activity, including DUIs.
Yeah, every state's a little different on that. I did a survey of states about maybe a year or so ago about their DUI laws, or the Medical Practice Act and DUIs. And California requires you to report a misdemeanor conviction within 30 days.
Right.
Or if you have a felony arrest within 30 days. Other
Right.
states like Arizona, it's 10 days. So every state is different.
So when you're going for reapplication, and you said that the orientation of the questions on reapplication for licensure are more around legal issues.
Yeah.
That's like a cross check with what they already know.
Right. So don't lie. They probably know it. All right. So we're right at 30 minutes. I just want to, an hour actually, 12:30 in California. So I just want to thank everybody for attending. And we're going to continue to do these webinars. So we're going to send these out. It's great. It's fun. And we can share our knowledge like we did today. I really appreciate everybody.
Thank
Greg,
Thank you very much.
Can I just make a quick comment and a question?
Yeah.
I think these are great. I think they're super. They're right in line with my passion. But are you recording these? Because I've got a number of people that I would love to be able to say, well, this webinar really kind of addresses that issue. You might want to check it out.
We are recording these. I don't know if we have all of them. We've done about 5, I think, on different subjects, but let us know. Write me or Jim. I didn't actually have Jim introduce himself, but Jim works with us at the Center for Professional Recovery, where I'm the medical director. And Raj is a technical guy that's supposed to know how to do Zoom. We're going to have to talk about the video thing here. In the future, we want to have videos when people are willing to show their face, because it's easier to talk to people that are visible. Anyway,
where would I get a recording? Because I have somebody who is in my caduceus group in Reno who would very much benefit from this, because he's going to apply as a new applicant, having just gotten his license in Nevada after having lost it over this issue.
So what about Jay Conway at cpr-la.com?
Okay.
That's Jay Conway, because Jim handles a lot of our public relations stuff. So Jay Conway at cpr-la.com. And if anybody wants that 2006 article that reviewed this, it was from the State Medical Board, Federation of State Medical Boards, send me an email, gregory.skipper@gmail.com.
For those folks too that are interested in the video, we can email it to you directly, as well as on YouTube, we have a Center for Professional Recovery page where we upload all the videos. And it's also tied into our website, our Center for Professional Recovery website.
So will this be on the YouTube?
Yes, we will get it up by the morning tomorrow. We will have it up.
So we have a YouTube channel. Is that what you're saying?
Oh, perfect.
Yes, sir.
Perfect.
Great.
You're so current, Greg.
We're coming into the 21st century here. All right. Thanks, everybody. I appreciate it.
Yeah,
y'all.
thanks.
Thank
Greg.
you.
I
Thank
love
you,
that
everybody.
recording
Bye-bye.
Thank
too,
you all.
so.
Thanks
Thanks,
very much.
Greg.
Very useful.
Bye.
Bye-bye.
Bye,
Thanks,
Trace.
Linda.
Bye, Mike. Bye, Linda.